the spinal cord today, and before I get started I want to tell you where we're going, really. The way that I'm going to take you through the central nervous system is to consider the nervous system as a bag of reflexes. Kind of alluded to that yesterday when I was talking about the different areas in the brain and the ones that were responsible for the integration of sensory and motor function. Those are the areas where this feedback takes place, this talking between the sensory system and the motor system. It's also a reasonable way to assess the central nervous system in a clinical sense. Where it falls down is if you start to look at cognitive neuroscience. If you look at modern neuroscience theory, it's pretty much turned this idea of a bag of reflexes on its head, and it's said that actually the central nervous system is something that has its own activities and its own functions and its own timers, and that those are much more important to it than anything that's going on outside, and that all the outside stuff is just peripheral add-on. And so this idea of starting at the bottom and going up is becoming a little bit outdated, and neuroscientists are saying that what we should do is start inside in the deep bits and work out. The problem with that is that it's a much more theoretical, complex approach and is even harder to fit into 9 lectures. And the other side of it is that you don't really get to anything that's clinically relevant until, well, let me think, I teach that to science students in 30 lectures, and we get to clinical relevance in the last 6 or 7. So there's an awful lot of baggage to build in before anybody sees where you're going. The way that we're going to teach it, I recognise that it's slightly outdated, and if you read the up-to-date texts, you'll see that I'm kind of doing it backwards compared to the way that most of the really up-to-date stuff does it, but it's perfectly adequate for a clinical understanding, and it's much easier to get into, it's much easier to get your teeth into. So what we're going to do is we're going to start with the spinal cord, and then we're going to go up the sensory system, and then we're going to come down the motor system, and then when we've been up once and down once, we're going to go back to the top and look at the executive functions of memory, cognition, that kind of thing. The spinal cord as an integrating centre. As I think I said on Monday, an integrating centre is a group of neurons that perform a function or some function, and can be as small as a spinal ganglion or a tiny nucleus within the brain itself, or as large as a cerebral hemisphere. The spinal cord is a good integrating centre to look at in a theoretical sense because it's quite big and quite accessible compared to much of the rest of the central nervous system, and that means that people have studied it extensively. And also, compared to the rest of the central nervous system, it's relatively simple. So those people that have studied it have, to a large extent, pinned down the functions of the various bits and sorted out how they relate to each other. And I can give you a really nice story about how the spinal cord works, which you can reflect upwards onto other integrating centres that we don't understand quite so well. So the first thing to know about spinal cords are that they are arranged into a series of dermatomes. Hopefully you'll have met the dermatomes in anatomy and in embryology, and you're aware that the animal as an embryo develops into a series of segments, and that each of those segments becomes a slice of the animal in the adult. So that we can say that this T8 slice here is a slice of embryological tissue that has developed into a slice of the animal, and all the nerves supplying that tissue, all the muscles in that tissue come from embryological segment T8. And we can slice up the spinal cord into the same dermatomes. There isn't the same physical connection between the dermatomes in the adult as there is in the embryo, in the sense that the body grows bigger than the spinal cord, so that the spinal cord itself only extends to about here in the dog, and all these later segments are expressed, really, I suppose is a good word, expressed in the spinal cord further cranially. And we've got the cauda equina, which takes those segmental nerves from further caudally forward into the appropriate segment of the spinal cord. But the whole thing is segmental. And so when we consider the spinal cord, we can first of all divide it into how it interacts with the tissues of its own segment and how it interacts with other segments of the spinal cord. The spinal cord doesn't directly interact with tissues in other segments. It's responsible for controlling the tissues in its segment and responsible for talking to other segments in order to coordinate function. And as I'm sure you'll be aware already, there are two major components of the spinal cord, as there are two major tissue components of the whole central nervous system, the grey matter and the white matter. And the grey matter is composed of neuronal cell bodies, and the white matter is composed of axonal pathways. And it's the myelin that gives the white matter its fatty white appearance. So if we take a transverse section through the spinal cord, this kind of butterfly of grey matter inside a sausage of white matter is the kind of thing that we see. And the grey matter is divided into a series of areas which are known as laminae. Technically, they are known as the Rexed laminae, after Rexed, who discovered them. And even more technically, you will only see them in neonatal animals, specifically neonatal hamsters, which is where Rexed looked for them. Because in those neonatal animals, these laminae have neurons that look different from each other down a microscope. So you can divide the laminae up and say, oh, that neuron looks like that, so it's this laminae, and these are the edges of the different laminae, and come up with this map. The map is lost in the adult. We don't see that morphological difference between the neurons, but these areas maintain their functionality. So this is a functional map of different neurons within a segment of the spinal cord, each of which are responsible for different actions. You'll also remember from embryology, I hope, have you done your embryology of the central nervous system yet? Yeah? 3 nods? Okay, that will do for me. You'll also remember that the most dorsal regions tend to be responsible for sensory function, and the most ventral regions tend to be responsible for motor function. And you'll remember last semester I was banging on about the autonomic nervous system being intermediolateral. In the segments of the spinal cord where there is autonomic function, there is a lobe of neurons here called the intermediolateral lobe, which is where those neuronal cell bodies live, the preganglionic neuronal cell bodies. But for the overall function, we're talking about a move from sensory to motor as we move from dorsal to ventral. So let's have a look at each of those laminae. Let's talk about what they each do individually, and then let's see if we can put a kind of a mental picture together of how they interact with each other. First of all, laminae 1, 2 and 3 tend to go together in people's minds and are also known as the substantia gelatinosa, the jelly-like substance. Again, one of those things that was unlucky enough to be found before we knew what it did, and it looked like jelly. The substantia gelatinosa takes sensory input from C fibers, i.e. high threshold mechanoreceptors and primary nociceptors. Fibers that we'll see later on are related to acute pain perception. And within the substantia gelatinosa, there is crosstalk over a few segments. There are neural processes that span 2 or 3 segments of the spinal cord and pass the sensory information that comes in directly to 2 or 3 segments. Lamina 4 is a primary input from A beta fibers, the cutaneous afferents, touch, heat. And a secondary input from laminae 2 and 3, i.e. there are interneurons that have cell bodies in laminae 2 and 3 that have processes, axonal processes that descend into lamina 4 and synapse on the cell bodies in lamina 4. So as well as a direct sensory input here, we've got the beginnings of a neural network. We've got the beginnings of different areas of the spinal cord talking to each other and transmitting information between themselves. Lamina 5 contains primary input from A, gamma and delta fibers, the medium threshold mechanoreceptors and the thermoceptors. More sensory perception. And guess what? It contains interneurons from lamina 4. And for the first time in lamina 5 here, we have evidence of spatial mapping. Remember I was talking about somatotopic localization or spatial mapping last lecture, and I used examples from the cerebral cortex and from the white matter of the spinal cord and one from the thalamus. Well, this level of the spinal cord here in the dorsal horn is the first time that we can see that. It's the first time it's evident. And it has a mediodistal orientation. What I mean by that is that the fibers here medially, or the neurons here medially, come from more distal parts of the segment. So let's imagine it's a limb segment. They're going to come from the toes at the bottom. And the fibers here more laterally come from the closer parts of the segment. So for the first time there is an indication that the fibers are aligned in the same sort of order that the body is aligned. And from there onwards, right the way up through the central nervous system, we see that spatial mapping. We see that alignment of neurons in their pathways. Lamina 6, primary inputs from A alpha fibers, muscle spindles and Golgi tendon organs. Interneurons responsible for reciprocal inhibition, i.e. the interneurons here, some of them are originating from the other side of the spinal cord and are responsible for that inhibition that we get within the spinal cord that allows us to walk in a controlled way, like I'm doing at the moment, with one leg swinging forward and the other leg swinging backwards, a reciprocal inhibition. This is the first time that we see those fibers entering the spinal segment from another segment, or rather from the other side of the same segment in this case. And this is the origin of much of the dorsal spinocerebellar tract, which probably won't mean much to you at the moment, but hopefully it will by the end of the lecture. Laminae 7 and 8 have no direct afferent input, no direct input from the external body. So by the time we get down here, none of these neurons originate, or rather none of these neural processes originate from outside the body. They are all interneurons from other segments. Before we go on, I want to go back to the start and talk about how the modalities that are perceived within this dorsal column of the spinal cord are changing as we go deeper in. From very highly consciously processed modalities like pain to modalities which are less consciously processed. If you are in pain or you get a noxious stimulus that you perceive as painful, it comes right up the top of the tree in terms of things that are brought to your conscious attention. Yeah? You can't be sitting in a lecture and have the person sitting next to you sticking their pencil into your arm and not be consciously aware of what's going on. But as we get deeper into the spinal cord and we go down, we are getting modalities which are progressively less consciously perceived. So for example, cutaneous afferents, pressure receptors, you can be sitting on your bottom in a lecture theatre and not be consciously aware of the amount of pressure that's on your backside for most of the time. I mean, if I drone on for hours and it goes to sleep, then it makes you consciously aware of it, but for the most part, it's not something that you're aware of the whole time. Going further in, thermoreceptors and medium threshold mechanoreceptors, How warm is your bottom? Well, you have to sit and think about that, don't you? It's not something that springs to mind the whole time. It's not something that's badgering at your attention, unless you were standing at the bus stop at 7 o'clock this morning and it was absolutely freezing, and then it's saying, you know, a bit cold down here, when's that bus coming? And when we get down to lamina 6, we're getting into sensory modalities that do not normally get to your conscious attention. It's not easy for you to say, even if you consciously think about it, how much tension there is in your muscles. Although you can sit there with your eyes closed and have a reasonable view of the amount of flexion in your joints, which you get from the joint proprioceptors. But in terms of muscle spindles and Golgi tendon organs, it's really difficult to get that information to your conscious centers. So as we descend into the dorsal horn of the spinal cord, we get progressively more interneural connections, and we get progressively less explicit conscious perception of what's going on. We're kind of sinking into a more autonomic area of function. Laminae 7 and 8. No direct afferent input. A convergent input from dorsal layers. So lots of interneurons from the more dorsal layers are beginning to converge down onto this lamina. Which systems did I say convergence was a hallmark of on Monday? People remember? The motor systems, yeah. So we are getting away now from sensory systems where information is coming in and diverging out to different laminae in different places into a more convergent motor type picture. We're moving away from the sensory spinal cord into the motor spinal cord. There is an input from the contralateral spinal cord and also inputs from other layers of the spinal cord. And this layer, or these layers rather, are the layers that organize the synaptic input to lamina 9. Lamina 9 is one of the important layers because it's the seat of the neuronal cell bodies of the alpha and gamma motor neurons that you will have met when you were doing the peripheral neurophysiology with Gordon looking at reflexes. Everybody remember the alpha motor neurons, the gamma motor neurons, the muscle spindles, the intrafusal and extrafusal fibers and all that malarkey? Yep. Well, when Gordon told you, as I hope he did, that the alpha and gamma motor neurons had their cell body in the ventral horn of the spinal cord, he was talking about lamina 9 of the spinal cord. These guys are important because they are the final arbiter of central nervous system function. If one of these lower motor neurons undergoes an action potential, then the muscle fibers that it is responsible for will contract, unless there's some kind of pathology in the way. So in the healthy animal, if a lower motor neuron develops an action potential, then its muscles contract. And the muscles don't have a choice about it. They don't get to integrate the signal further. They don't get to think about it. They just do it. It's the lower motor neuron that does all that processing of all that information. And when I was talking about the lower motor neuron having about 50,000 synapses from different pathways, some of those pathways were interneurons from within the segmental spinal cord grey matter. Some of them were interneurons from the contralateral spinal cord grey matter. Some of them were neurons from the grey matter of other segments of the spinal cord, and some of them were from the higher centres of the central nervous system, going all the way up in man and the primates at least to fibres which have their cell bodies in the primary motor cortex of the cerebral cortices. So fibres from just about everywhere get into laminae 7, 8 and lamina 9 and contribute to that integration of motor function which causes the muscles to contract. Last but increasingly not least, we've got lamina 10 tucked away in the middle. when I first penned this slide, 6 or 7 years ago now, the function of lamina 10 was largely obscure. Who knew what it did? But more and more studies have been brought to bear on it, and we're now beginning to appreciate the importance of lamina 10 in the mediation of arousal and wakefulness and other things which we tend to think of as functions of the higher centres of the spinal cord. Rather the brain, the higher centres of the brain. But lamina 10 and the ascending reticular formation neurons that are within lamina 10 have a significant role to play in terms of the function of the higher centres. They convey information up the spinal cord, which the brain uses to decide on an appropriate degree of arousal or awareness. And interestingly, in terms of anaesthesia, if you anaesthetise these areas of the spinal cord and not the brain still becomes anaesthetised. And if you anaesthetise the brain and not those areas of the spinal cord, you need an awful lot more anaesthetic in order to produce anaesthesia. So these areas seem to mediate arousal and awareness and level of conscious function. They also carry the majority of the decussating fibres which cross from side to side in this ventral decussating pathway, which is just here ventral to the central canal of the spinal cord. So those are the laminae individually. That's what each lamina does. That's the makeup of the neurons that each lamina carries. And if you put those individual laminae together in a sort of a topographical map, you come out with this kind of thing. And you can see here that I have represented each lamina just as a circle, and I've drawn some of the interconnections between the laminae to give you an indication of what's going on. And hopefully you can see that as we progress deeper into the spinal cord, we're getting less and less overt sensory information coming in. We're getting more processing of information, and we're getting output to both the muscles from lamina 9 and also to the other side of the spinal cord and other segments and the central nervous system via the spinocerebellar tract from lamina 6. So that hopefully gives you a picture of how, even at the level of the spinal cord, there's a lot of integration of signals from lots of different places which are processing information and making decisions about appropriate motor outputs. So let's have a look at some of those motor outputs. This is a neuronal cell body. It happens to be a lower motor neuron, so it's going to be in lamina 9 of the spinal cord. It happens to be a lower motor neuron of muscle fibres which are in an extensor muscle. Here are some inputs from within the segment which influence the output of that motor neuron, and hence the degree of tone or contraction in its extensor muscle. And I've labelled these or coloured them so that red is excitatory and blue is inhibitory. So what do I mean by that? Well, let's go from the top. A sensory input from a muscle spindle, if it's a homonymous muscle spindle, i.e. a muscle spindle from the same muscle, or a synergistic muscle spindle, a muscle spindle from a different muscle that has the same function as that muscle, then it's excitatory. And you know that, excuse me, a bit froggy this morning. You know that because you know from the monosynaptic reflex arc that a contraction of a muscle spindle sends sensory information back up to the spinal cord and makes this neuron contract. That's the patella or monosynaptic reflex. an antagonistic input from a muscle spindle in an antagonistic muscle, a flexor muscle this time if this is an extensor, inhibits output from this muscle. So that not only does contraction in an extensor spindle increase tone and so force in that muscle, but a contraction from an antagonistic muscle spindle inhibits this output. If we look at the Golgi tendon organ, it's the reverse. And hopefully you'll remember that the muscle spindle is the day-to-day setting of muscle tone, moving of muscles structure, and the Golgi tendon organ is the pressure relief valve that stops the muscle squeezing so hard that it damages things. And so when a Golgi tendon organ sends a signal in, from the homonymous and synergistic muscles it's inhibitory, and from the antagonistic muscles it's excitatory. So that if a flexor is over-contracting, then the extensor will become excited and will put some tone on to oppose that force. From skin in the segment, both touch and pressure increase extensor muscle tone, so that when you touch a surface, there's a natural tendency to push against it, to interrogate it with your fingers, to see what kind of texture it has, to see how springy it is, to see how sharp its edges are, just to kind of push against it and interrogate it. But if that surface hurts you, then there's a tendency to pull back from it. So touch and pressure fibers in the skin are excitatory to this extensor muscle, but pain is inhibitory. Pain inhibits that extension and allows the flexors to pull the limb away from the painful stimulus. On the other side of the body, the contralateral side, touch, pressure and pain are all excitatory. So that if you touch something with the fingers of one hand, you tend to get an increase in extensor tone in both limbs. And if there's pressure exerted against one limb, you tend to get an increase in extensor tone in both of them. But if there's pain, then the limb that senses the pain pulls away, and the other limb extends even more to really give it a push and get it away from that painful stimulus. And finally, we've got the feedback loop of the Renshaw cell, which senses an input, an action potential going down the axon of the lower motor neuron, and feeds that back to the cell body in an inhibitory way to prevent that muscle system going into tetanus, to limit the amount of contraction that can be, or contractive signals that can be sent down that axon. So that's an example of how the sensory systems within a segment, both on the same side and the other side of the spinal cord, can influence the degree of tone in a lower motor neuron. And that is the first level of reflex activity. That's the monosynaptic reflex that you already know about, with a few other bits of sensory information added into it and integrated in to give you an overall muscle tone. What we're going to do now is we're going to look at the input of the other segments. We're going to look at the ascending and descending pathways in the white matter of the spinal cord. Now, this diagram has the ascending sensory pathways illustrated on the left and the descending motor pathways illustrated on the right, to keep it simple. I know you're not going to say this because you're far too intelligent, but a few years ago a veterinary student tried to tell me that the pathways on the left were sensory and the pathways on the right were motor. That's not the case. Sensory and motor pathways both occur bilaterally. But if I drew all the colours on both sides, it would really get very confusing. And so I've separated the two out. And what I want you to do is imagine, when you're thinking about the sensory pathways, that there's a mirror image of this on this side of the spinal cord. And when we're talking about the motor pathways, there's a mirror image of these on this side of the spinal cord. so that these pathways are not complete, in the sense that not all the neurons in this area will belong to this pathway. Some of the neurons in this area will belong to this motor pathway as well. And not all the neurons in this area will belong to these pathways. Some of the neurons will belong to those pathways. So there is a mixture of sensory and motor fibres in different parts of the white matter of the spinal cord. But if you look at it overall, a general simplification of this is to say once again that sensory systems tend to be dorsal and motor systems tend to be ventral. So once again we've got that overarching pattern of moving from dorsal to ventral being moving from sensory to motor. Isn't it easy? What I'm going to do now is look first at the sensory pathways and then at the motor pathways and name them and begin to talk about what they do. And when you first see this diagram, you will cry because it's got lots of big words on it, but it's actually very simple and very straightforward. Because there is a system for naming the pathways of the white matter in the spinal cord. And the system says, first of all, we name where it comes from, and then we name where it goes to. So if you look at this one, the ventral spinocerebellar tract here, it comes from the spinal cord and it goes to the cerebellum. It's the spinocerebellar tract. So that makes life easy. If you know where a tract starts and ends, you can work out its name. And even better, if you know its name, you can work out where it starts and ends. And if you can work out where it starts and ends, you can work out whether it's sensory or motor, because a spino-something tract will always be sensory. It's always carrying information from the spinal cord to somewhere else. There are, of course, exceptions to that rule, just to make life interesting. And the exception to this rule is the dorsal funiculus, up at the top, dorsally. The dorsal funiculus is another one of those unfortunate big structures that was named before we knew what it did. A funicular railway is a railway that goes up a cliff, like the funicular railway in Wellington, you know, that goes up the hillside? Yep. So the dorsal funiculus is a railway or a pathway of fibres that goes upwards, goes up the hill, and is located dorsally. So it's kind of logical, but it doesn't say a great deal about what it carries or where it goes. We'll learn more about the dorsal funiculus in the next lecture because it's one of the big sensory pathways for the conscious modalities. But all the other sensory tracts that you will meet are spinocerebellar, spinothalamic from the spinal cord to the thalamus, spinoreticular from the spinal cord to the reticular formation, whatever. They come from somewhere, they go to somewhere. This is an example of muscle proprioception in the spinocerebellar tract. And I don't want you to get into details of this just at the moment. We will meet it in more detail in probably the next lecture. It's in all the textbooks. These diagrams of neuronal pathways are almost exclusively borrowed from Tony King's book, which I've made reference of in your further reading. So if you want to look at these diagrams, then get Tony King's book out of the library, have a look at it, work out what's going on, but don't worry about the details for the moment in the lecture. I want to use it today to illustrate a couple of principles. The principles that I want to illustrate are decussation and, to some extent, redundancy. The spinocerebellar tract is a tract of the vestibular system, the postural and balance system. And as such is the only major ascending tract that is ipsilateral. What I mean by that is that sensory fibres from this side of the body ascend into the cerebellum through the cerebellar peduncles on the same side of the body. And the cerebellum is an ipsilateral organ. It's an organ that deals with information on the same side of the body. But even here, there are pathways which decussate. You can see this pathway here coming from the Golgi tendon organs, decussating in lamina 10 of the spinal cord and getting into the ventral spinocerebellar tract, ascending to the brainstem and then getting into the cerebellar peduncles and decussating back to the ipsilateral side. It's a double decussation. And what it's doing is it's allowing some information to go up the other side of the spinal cord, which is cunning because if you get a lesion on this side of the spinal cord, you're still going to get some information ascending and getting past that lesion. So there is still going to be some function. But, importantly, information that comes from one place winds up in one place. It just gets there through a different route. Here is an example of a contralateral pathway, the pathway, the dorsal funiculus. And again, more detail is coming, so don't worry about the detail for today. Pathway carries information about touch in the dorsal funiculus and information about heat in the spinothalamic tract. And generally speaking, the information about touch in the dorsal funiculus ascends the spinal cord ipsilaterally on the same side, and the information about heat in the spinothalamic tract ascends contralaterally. It decussates, it crosses the midline and ascends contralaterally. But when we get to the level of the brainstem here, and this is the medulla, these dorsal funicular pathways then decussate so that they line up contralaterally with the spinothalamic tract pathways. So we've got information going up both sides of the spinal cord, but it's because one pathway has already decussated and the other pathway hasn't yet decussated but is about to. And then going up through the midbrain and the thalamus into the cerebral cortices, the information goes together, so that information from one place goes to one place. Not always the same route, but the same start tends to have the same end. And again, if you were to have a one-sided lesion in the spinal cord, you may well knock out some of these fibres, but not all of them, and there would remain some residual function. So there's some aspect of redundancy there. Okay, let's go on to talk about the motor tracts. Motor tracts. Once again, they are named for where they come from and where they go to. So this vestibular spinal tract comes from the vestibular system and goes to the spinal cord. And because it's something ospinal, we know it's a motor tract. The reticular spinal tract comes from the reticular formation. The rubrospinal tract comes from the red nucleus or nucleus rubris. The corticospinal tract comes from the cerebral cortex and goes to the spinal cord. They're all motor tracts. They're all named for where they came from to the spinal. Once again, there is an exception to the rule, and that is the medial longitudinal fasciculus. There it is, a little yellow thing tucked up there. The good news is that it's not really important in our species. It's important for us, and it would be important if we were pretty much any sort of primate. But for the carnivores and for the herbivores particularly, this pathway is less important, and in the herbivores mostly doesn't extend beyond the cervical regions of the spinal cord. The point about it is that it is a spinal extension of the pyramids, which are a motor system that we will meet in detail later in the lecture course, but one of the bigger parts of the motor system. And again, sufficiently big that they were named before we knew what they did. They're called pyramids because they're pyramid shaped. And this longitudinal fasciculus is an extension of those pyramids. Interestingly, as the fibres of the pyramidal system leave the pyramids to become the corticospinal tract, they decussate. And so whilst this is a contralateral motor pathway, this medial longitudinal fasciculus is an ipsilateral pathway. It's on the same side of the spinal cord as the brain that it comes from. But its fibres, before they get to lower motor neurons, all decussate. So we've got more decussation going on at a different level. And here it is again, the pyramidal system. Once again, let me emphasise, let's not get hung up on the detail. I'll be spending a fair bit of time on the pyramidal system in one of the later lectures. But you can see here in the medulla that these fibres decussate to become the corticospinal tract. But the medial longitudinal fasciculus doesn't decussate, and it continues on down the same side of the spinal cord. Enough of the dead spiders. Let's get back to some physiology. We've talked about how the spinal cord processes and how it does what it does. But how much processing does a spinal cord do? What can it deliver without input from the higher centres of the spinal cord? There used to be a standard physiological preparation, it was called, that was done for neurophysiology students to look at and coo over, and it was known as the spinal cat. You take a cat and you section its spinal cord at the top and cut the brain away from the spinal cord, and then you allow the cat to recover from its anaesthesia and you see what it's capable of doing. And all the students go, oh look, it can do this, oh it can't do that. We don't do that anymore, pleased to say. But if you look at the amount of processing the spinal cord can do in, say, a spinal cat preparation, this is what you see. This is a graph of the joint angle of the various joints, and it's from a human textbook. So there's an ankle joint, a hip joint, and a knee joint. But the joint angle changes in a predictable way through the phase of walking. So there's a stance phase, there's a swing phase, and another stance phase. And the toe lifts off the ground here and gets back onto the ground there. And all that coordinated change in the angle of the different joints and the coordinated muscle movement that goes with it and the coordination between the legs, both contralaterally from side to side and also in a long sense between the joints of the hind limb and the joints of the forelimb, is all coordinated by the spinal cord. And so a spinal cat can't walk. It can't make a decision to go forwards, but if you put it in a sling and balance it above a treadmill and move the ground under it, then it will form a walking gait that looks quite normal, and it can walk quite happily along ground that's moving under it in a coordinated manner. If you are even more mean to that cat, if it's possible to be more mean to that cat, and you put a clothes peg onto one of its toes, then you will change its gait and it will walk and shake its leg while its foot's up, and then go down again and shake its leg again to try and get the clothes peg off. And all that walking and shaking all at the same time is all mediated by the spinal cord with no input from the higher centres of the brain. One of the things that I want to illustrate to you in the motor lectures, which will come maybe not next week but the week after, is that the degree of motor function that you have in your motor system varies as you descend the spinal cord, or the brain generally. So that within the spinal cord, all this integration of ipsilateral, contralateral function and swinging gaits is going on. In the midbrain, there is a centre known as the mesencephalic locomotor region, which is responsible for initiating this spinal movement and by the amount of stimulation that it gives to the spinal cord, changing the speed of movement and the gait of movement to some extent. And in the higher centres, there are motor regions which go, let's go down to the pub and get the mesencephalic locomotor region into that walking business, so that the motor function that we have as it descends from the higher centres gets less and less cognitive and more tuned to the eventual muscles that are going to be innervated by those lower motor neurons in lamina 9. And the whole thing is about information being progressively changed as it descends down the spinal cord. But an awful lot of that processing goes on at the level of the spinal cord without any oversight from what's going on above, apart from the initiation that makes it all happen.